This is Crystal Fenn from MedPage Today. I'm here at the American Diabetes Association meeting in San Francisco, where findings from the advanced trial of intensive blood glucose management are the hallway buzz. Here, Drs. Stephen MacMahon and Anushka Patel, both of the University of Sydney, discuss the trial design and findings.
The advanced study is the largest ever study of treatments for the prevention of the complications of diabetes. It was conducted in 20 countries around the world, in more than 200 different sites. The two sponsors were the National Health and Medical Research Council of Australia and Servier, who are the manufacturers of some of the study drugs that were involved, used in the study. Advance was designed to address two questions: the effects of glucose control, which is the topic that we're addressing here today, the effects of blood pressure lowering on major vascular complications, both macrovascular, so myocardial infarction, stroke, cardiovascular death, and microvascular, including both kidney and eye disease.
Approximately half of the patients received the intensive glucose control strategy and half the standard glucose control strategy. And we had excellent follow-up of participants with no data on vital status where the patient was dead or alive, on only 17 patients at the end of follow-up. And really, the vast majority of patients had a full assessment of the last visit, which was on average 5 years after the study commenced. By the end of the follow-up period, the mean hemoglobin A1C level was 7.3% in the standard group shown in orange here and 6.5% in the intensive control group shown in blue. If we then look at those two major components, firstly microvascular events, so the kidney and eye complications, we see that that overall effect was primarily due to a significant 14% reduction in kidney and eye complications. In terms of macrovascular events, heart attack or stroke, there was no apparent effect of the intensive glucose control strategy on this outcome. So the relative risk reduction was 6% with a confidence interval of -6 to 16% and a p-value of 0.32. So we did not find a significant effect on this outcome. So to conclude with some key findings, I think in advance we did demonstrate that it was possible to achieve the hemoglobin A1C using the type of pragmatic and flexible approach that was described by Dr. MacMahon. The intensive glucose control significantly reduced serious vascular complications of diabetes, primarily kidney disease. There were no clear effects on macrovascular complications, that is heart attack or stroke. But I think importantly, using the strategy that we employed for intensive glucose control in advance, there is no evidence of an increased risk of death.
So to sum up, the conventional 7% goal for hemoglobin A1C appears to be vindicated for cardiovascular outcomes in diabetes. I'm Crystal Fenn, MedPage Today.